Hi friends, welcome to the channel The Nurse. Here we are discussing about NIMHANS nursing exam series 11th part. In this video, we will discuss about mainly about psychology, that is specifically abnormal memory and perception. We will go to the topic. Before that, if you are not subscribed to our channel, please subscribe. So, as you know, NIMHANS exam will be conducted on 17th of December 2023. So, we will go to the topic. So, if you are not watched our previous videos, means you can watch the videos from our playlist NIMHANS Nursing Officer Exam Series. So, all the previous Nursing Officer Exam questions also included in that playlist. So, you can watch it there. So, we will move to the topic NIMHANS Exam Series 11th part. So this is our 11th part, previous 10th video part you can watch in our series playlist. First question here, which of the following is a type of abnormal memory that involves the loss of memory for events that occurred before a brain injury or disease? Anterograde amnesia, retrograde amnesia, dissociative amnesia, transient global amnesia. So here important word is that is occurred before a brain injury. The loss of memory for events that occurred before a brain injury. So that is the word highlighted here. So you can give the correct answer, that is retrograde amnesia. So we will discuss each and every type of amnesia here. So you will get an idea, proper idea. First we will discuss about retrograde amnesia. It is a type of abnormal memory, that is memory loss. Amnesia means memory loss. It is a type of abnormal memory that involves the inability to recall past events or information that were stored in long-term memory before a brain injury or disease. So that memory after the brain injury or disease, you will get a memory loss. So previous of that previous events occurred before the injury or disease will be lost. So that type of amnesia is known as retrograde amnesia. The extent and duration of retrograde amnesia may vary depending on the severity and location of the brain damage. Usually hippocampus and nearby structures helps in the memory process. So the injury to hippocampus mainly affects the memory loss. So that severity and location of the brain will cause the extent and duration of retrograde amnesia. So in the same way, anterograde amnesia is just opposite to retrograde amnesia. In retrograde amnesia, it is before the events will forget, that is occurred before the injury or disease. Anterograde amnesia is just opposite, the events or that incidents that happened after the injury will be forget. In anterograde amnesia is a loss of memory for events that occurred after a brain injury or disease. That is anterograde. Antero means after, retro means before. The line is injury or disease. So before the injury, that is retrograde. After the injury, that is anterograde. Then another option was dissociative amnesia. Dissociative amnesia, that is due to psychological effect. So here mainly you need to think about the mental torture or mental factor affected here. Dissociative amnesia is the loss of memory for personal information or traumatic events due to psychological factors. Maybe that is psychological trauma or any other psychiatric illness that will lead to dissociative amnesia. Particularly, the person will lose his personal identity, his name, place, relatives, etc. He will forget. Transient global amnesia is also another type of amnesia caused by psychological factors. That is a temporary loss of memory for recent events and personal identity. So after sometimes patient will get that memory, but for a short term, the person will lose all the memory. That is temporary loss of memory. Then second question, which of the following is a type of abnormal memory that involves the creation of false or distorted memories either spontaneously or in response to suggestion? Options: confabulation, kleptomania, false memory syndrome, all the above. So here correct answer is all the above options are example for abnormal memory that involves the creation of false or distorted memories either spontaneously or in response to suggestions. So we will see what is confabulation, what is kleptomania, what is false memory syndrome and the difference. Confabulation, kleptomania and false memory syndrome are all types of abnormal memory that involves the creation of false or distorted memory. So in all the three types, there will be a creation of false distorted memory. So we will see each and every one, then you will identify what is the difference between all the three abnormal memory type. First, we will see what is confabulation. As you know, confabulation means it is the production of fabricated or distorted memory without the intention to deceive, often seen in patients with brain damage or dementia. The persons will fill the memory gap with some information. So that may be without his knowledge, and it is known as confabulation. The memory gap is filled with some that person's information. Same time, kleptomania is the unconscious plagiarism or appropriation of another's idea or words due to a failure to recognize their original source. So kleptomania means it is like a copying of another person's idea and the person without his knowledge. The person will not recognize it is already discovered by another person's, but the person will introduce us his own idea or his own memory. So that kind of abnormal memory type is known as kleptomania. That is plagiarism or appropriation of another's ideas or words due to failure to recognize their original source. The person will not recognize it is originally discovered by another person's mind or another person's idea. In the third condition, false memory syndrome is the formation of vivid and detailed memory of events that did not actually happen, usually as a result of suggestive technique or therapy. So, if patient is going for cognitive behavioral therapy under some suggestive technique therapy to manage his memory deficit and all, so in that time, patient will create or formulate a vivid, clear type of memory, some events memory he will formulate, and it will be fixed in his mind. So that is known as false memory syndrome. That is the formation of vivid. It will be very clear. Each and a specific minute ideas will be very clear, and detailed memories of events that did not actually happen, usually as a result of suggestive technique or therapy. So these are the difference between confabulation, kleptomania, false memory. Confabulation means gap filling. Kleptomania means copying another's idea without his own knowledge. False memory means formation of vivid and detailed memory of events that did not actually happen. Then third question, which of the following is a type of abnormal memory that involves the excessive and intrusive recall of past events often associated with negative emotions? So the last sentence is very important. It is associated with negative emotions. The abnormal memory that involves excessive and intrusive recall of past events often associated with negative emotions. Flashbulb memory, hyperthymesia, reminiscence bump, rumination. So these are the some new words or new vocabulary for you to remember. So that is why I selected this topic especially for NIMHANS exams. So here correct answer is rumination. So we will see each and every options here. What is flashbulb memory? What is hyperthymesia? What is reminiscence bump? And what is rumination? So first we will see what is rumination. It is a type of abnormal memory that involves repetitive and persistent thinking about past events. Some bad events maybe occurred his past. So he will always think about that memory, and it will not result any solution making. So that will leads to some other problems like excessive stress, and finally it will leads to depression like disease. So that is why rumination is important without leading to effective solutions or actions. Simply, they are thinking about their past events continuously, and they may be very sad about that events. Rumination is often associated with the negative emotions such as depression, anxiety, guilt, or shame. Rumination can impair cognitive functioning and well-being by increasing stress and interfering with the problem solving. So, because of this kind of thinking process, it will leads to cognitive function of his mind, and it will finally leads to more increased stress and interfering with the problem solving capacity, because the solution of problem is not happening here in rumination. They're just thinking of the events only. They do not try to solve the issue. Then second option we have discussed, that is flashbulb memory. Flashbulb memory is a vivid. That means it is a clear and a detailed memory of a emotionally significant event. Sometimes any accident and some like that events occurred in person's life means the person will be clearly remember that particular incident, each and every parts of that details of the events. He will not forget his entire lifetime. So that kind of memory is known as flashbulb memory. It will be very, very clear and it will be fixed in his mind. He will not forget in his lifetime. So that kind of memory, flashbulb memory. Then hyperthymesia. Hyperthymesia is an exceptional ability to recall one's personal life events in details. So this is some kind of ability that person is able to remember his personal life events in more detailed. So that kind of memory is known as hyperthymesia. The ability is known as hyperthymesia. Then third, one more option was there, that is reminiscence bump. Reminiscence bump is a tendency to recall more memories from adolescence and early adulthood than from other periods of life. So the person is able to remember the memories from his early adulthood and adolescence period time, but he may not be able to remember his other period of life. That means younger childhood period or older adulthood period and all. He is not able to remember, but he is able to remember specifically the events occurred in adolescence period and early adulthood period. So that kind of memory is known as reminiscence bump. So fourth question, which of the following is a type of abnormal memory that involves the inability to form new memories due to damage to the hippocampus or other parts of the medial temporal lobe? So I told you hippocampus is the main part of the brain, helps to retain the memory. So here it is asking the abnormal memory that involves the inability to form new memories due to damage to the hippocampus or other parts of the medial temporal lobe. Anterograde amnesia, Korsakoff syndrome, post-traumatic amnesia, all of the above. Correct answer, all of the above. So all the three conditions, patient may not be able to create new memory because of the damage to the hippocampus and other parts of the medial temporal lobe. So we will discuss in detail anterograde amnesia, that I already told. Anterograde amnesia means amnesia that occurs mainly after the injury or disease. So person may not able to remember the events occurred after the injury or disease. That is known as anterograde amnesia. Korsakoff syndrome and post-traumatic amnesia are all types of abnormal memory that involves the inability to form new memories due to damage to the hippocampus or other parts of the medial temporal lobe. The hippocampus and the medial temporal lobe are crucial for consolidating short-term memories into long-term memories. So because of the damage to hippocampus, the person is unable to change the short-term memories into long-term memories. Then anterograde amnesia can result from various causes such as stroke, tumor, infection, surgery, or head injury. Korsakoff syndrome is a chronic form of anterograde amnesia caused by chronic alcoholism or thiamine deficiency. Post-traumatic amnesia is a temporary form of anterograde amnesia that occurs after a head injury. So, but that will regain later. Post-traumatic amnesia, that is particularly temporary period of time, person will lose the memory. Fifth question, which of the following is a type of abnormal memory that involves the selective loss or alteration of autobiographical memories due to psychological factors such as trauma or stress? Dissociative amnesia, dissociative identity disorder, repressed memory, all of the above. Here correct answer is all of the above. So we will discuss this question in detail. So dissociative amnesia, dissociative identity disorder and repressed memory are all types of abnormal memory that involves selective loss or alteration of the autobiographical memories. Autobiographical memory means the person will lose his identity, his name, his age, his mother's name, his father's name, his siblings' names. He will forget. Even he will forget his house location. So this kind of abnormal memory type is happening in dissociative amnesia, dissociative identity disorder, and repressed memory because of some psychological factors such as trauma or stress. Then what is dissociative amnesia? It is a disorder characterized by inability to recall important personal information. Important personal information may be his name, age, or relatives' names, like that. It will be usually due to traumatic or stressful in nature. The main reason for dissociative amnesia may be post-traumatic or stressful because of stress. So dissociative identity disorder is a little bit serious condition. Earlier it is known as multiple personality disorder. Now it is changed to dissociative identity disorder. DID is a disorder characterized by the presence of two or more distinct personality states that recurrently take control of the person's behavior along with the gaps in memory for personal history. The persons will not understand he is behaving like that two separate personality. Without his understanding, persons will behave like that two separate persons. One may be a childhood character. Sometimes one may be an older aged person's character, or some may be some opposite religion. Some may be some different religion. So like that, personality difference may be there. Sometimes it will be. Sometimes the person may behave like that opposite gender, like that. The personality entirely different from his original personality. So, but he will not recognize. So that kind of disorder is known as dissociative identity disorder. Sometimes person will behave like that two or more personality. That also may occur. Then repressed memory. Repressed memory is a controversial concept. So it is still on a debated topic. Repressed memory is there or not, but still it is a controversial concept. That means a memory of a traumatic event that is unconsciously blocked from conscious awareness. So that kind of condition is known as repressed memory. So these are the conditions that in that a person's autobiographical data is selectively forget. The three conditions are dissociative identity disorder, dissociative amnesia, repressed memory. In these three conditions, the persons will forget his personal informations. Sixth question, which of the following is a type of abnormal thought that involves unwanted and intrusive images or impulses? Which of the following is a type of abnormal thought that involves unwanted and intrusive images or impulses? Obsessions, delusions, hallucination, ruminations. So rumination we have already discussed it. So we can eliminate these options. So in all three options, you can select the correct answer. Correct answer is obsession. Obsession means it is an abnormal thought that involves unwanted and intrusive images or impulses. So after obsession, patient will do the compulsive behaviors. Obsessions are recurrent. That means repetitive and persistent thoughts or images or impulses that cause anxiety or distress. So it will lead to anxiety or distress. So patient has to do some activities to remove that anxiety. They are not simply excessive worries about real life problems, but rather irrational. There will not be a reason for that. That reason for the worry will not be rational. We cannot. That person cannot prove, or they cannot give proper reason for that. Still, the person has to do that. Obsessions or that thoughts. Then intrusive ideas that the person try to ignore or suppress. If he is try to ignore also, it will come out. So that is that strong and recurrent thought that is known as obsessions. So because of that thought, if that person is not completing that recurrent or persistent thoughts, the person, it will leads to the anxiety and stress. Obsessions are common feature of obsessive compulsive disorders. So obsession will lead to compulsions. Compulsion means actions. So that condition is known as obsessive compulsive disorder, OCD. Example, repetitive hand washing seen in some persons. So which of the following is a type of abnormal thought that involves false beliefs that are firmly held despite evidence to the contrary? Obsessions, delusions, hallucinations, ruminations. Here correct answer is delusions, false fixed beliefs. That is simplest definition of delusions. We cannot change the delusion easily, so it will be fixed in his mind. Delusions are fixed and false beliefs that are not shared by others in the person's culture or subcultures. They are not explained by the person's level of education, intelligence, or religious background. Delusions can involve themes such as persecution. What is a delusion of persecution? You can comment below. And or grandiosity, delusion of grandiosity, or delusion of reference, control, or somatic. These are the examples of delusions. Delusions are common features of psychotic disorders such as schizophrenia. Then eighth question, which of the following is a type of abnormal thought that involves sensory perceptions that occur in the absence of external stimuli? Obsessions, delusions, hallucination, ruminations. So we have discussed about obsession, and also we have discussed in previous question about delusions. Rumination in we have explained. Then we can eliminate all three options. Then hallucination only left here. So correct answer will be hallucinations. Hallucinations are experiences of seeing, hearing, smelling, tasting, or feeling something that is not there. So there will not be a stimuli. Without a stimuli, the person's perception is mistaken, and he will think about something else. They may be caused by drugs. The hallucination may be caused by drugs, alcohol, medications, or medical conditions. Hallucination can be auditory, that is, hearing voices or sounds. Visual hallucination may be seeing images or flashes. Or olfactory hallucinations, that is, smelling odors. Gustatory hallucination, that is, tasting flavors. Or tactile hallucination, that is, feeling sensation. These are some types of hallucinations. Hallucinations are also a common feature of psychotic disorder such as schizophrenia, that is, positive symptoms. So can you give an example for some common hallucination seen in schizophrenia? So you can comment it below. What psychological factor is commonly associated with individuals engaging in infidelity? Infidelity means suspecting the spouse, or wife is suspecting husband, or husband is suspecting wife without a proper reason. What psychological factor is commonly associated with individuals engaging in infidelity? Low self-esteem, high emotional intelligence, introverted personality, positive self-image. The common factor, that is low self-esteem, that will lead to infidelity. Individuals with lower self-esteem may be more prone to seeking validation or satisfaction outside their primary relationships, contributing to a higher likelihood of engaging in infidelity. 10th question, which of the following is a cognitive behavioral technique that can help reduce abnormal thoughts by challenging their validity and replacing them with more realistic and adaptive ones. Thought suppression, thought stopping, thought recording, thought substitution. So if you are going through the question a little bit clearly, means you can give answer here. So correct answer is thought substitution. So in this replacing them, that words if you are highlighting means you can give answer here. So substitution means replacing. So we will see what is thought suppression. Thought suppression means it is a technique involves trying to push away or ignore the negative thoughts. However, research shows that thought suppression can actually make the thoughts stronger and more persistent. It is not that much effective, but still it is used to suppress the unwanted thoughts. Then thought shopping. It is another technique used in cognitive behavioral therapy. This technique involves using a self command to abruptly interrupt a negative thought. So the person will stop that unwanted thought. While it might be offer temporary relief, it will give a temporary relief from unwanted thoughts. It doesn't address the underlying causes of the thought and can lead to rebound effect. It will come again, where the thought returns with even greater intensity. So it will also leads to problems in future. So thought suppression and thought stopping we cannot use as a permanent solution. Only for temporary relief we can use. Then thought recording. It is a little bit realistic technique. In this technique, it involves simply writing down your negative thoughts. So person will write down the negative thoughts and he will also record the time of the thought and the reason for that unwanted thoughts, and these and all the persons will note it. Then he is able to understand what is the actual problems and he can make solution for that. It will helpful for identifying and tracking the patterns. It doesn't directly challenge or change the thought itself, but in future it will help to understand the reason and he can solve the issues. Thought recording can help reduce the frequency and intensity of abnormal thoughts by increasing awareness and rationality. So he will get an idea of unwanted thought process. Then he can increase the gap between that, reduce the frequency and intensity of abnormal thoughts. Same time, thought substitution means it is a technique, it is a more effective technique to stop the unwanted thoughts. The technique actively replaces negative or unhelpful thoughts with more realistic and adaptive ones. By challenging the validity of the negative thoughts, providing evidence to the contrary, and developing a more positive alternative, this technique can actually change the way you think and feel. So it will be more useful in cognitive behavioral therapy to stop unwanted thoughts. Why we need to stop the unwanted thoughts? Because it will leads to anxiety, stress, then finally it will leads to depression. So in order to prevent the patient from this kind of diseases, the cognitive behavioral therapy will helps. Then 11th question, what is a common feature of critical thinking? Accepting information without questioning, relying solely on emotions, analyzing and evaluating information, avoiding logical reasoning. So here correct answer is analyzing and evaluating information. That is a common feature of critical thinking. Critical thinking involves analyzing and evaluating information rather than accepting it without questioning. So option A, B, D are not characteristics of critical thinking. 12th question, which of the following is a type of abnormal perception that involves a misinterpretation of a real stimulus? Hallucination, illusion, delusion, confabulations. It is an easy question for you. So correct answer is illusion, misinterpretation of real stimuli. An illusion is a type of abnormal perception that involves a distorted or erroneous perception of a real stimulus. Illusions can be caused by various factors such as sensory deprivation, fatigue, emotional state, or expectations. Illusions are not specific to any mental disorder but can occur in normal or abnormal conditions. Then 13th question, which of the following is best characterize kleptomania? So you need to understand what is kleptomania, then only you can answer here. Kleptomania means stealing behavior. So options are planned and deliberate theft, impulsive stealing without a personal need or financial gain, professional theft for financial profit, theft driven by revenge motives. So kleptomania, that is the main characteristics of kleptomania, that is impulsive stealing without a personal need or financial gain. There is no use for that particular person with that stolen things, but there will be an impulsivity to steal that thing without a financial gain or personal need. So usual other kind of theft means the persons will get sometimes financial profit, sometimes that may be due to any revenge motives. So sometimes it may be a planned or a deliberate theft. But in kleptomania, it will be impulsive. That situation, in particular situation, it will be an impulsive to steal that thing, objects. There is no reason for that particular. There is no specific reason for that. Because of that impulse, the person will steal the object. Kleptomania is characterized by the inability to resist. That is impulsivity. Inability to resist impulse to steal items, often with little or no personal use for the stolen items, and without an underlying motive such as revenge or financial benefit. Then 14th question, what distinguishes exhibitionistic disorder from consensual exhibitionism? So exhibitionistic disorder, that is a psychological condition. So that is different from consensual exhibitionism. Consensual exhibitionism means that is a legal exhibitionism, or with the consent. With the consent, the person is exhibiting his body parts. So what is the difference is asking in question. So options: legal consequences, exhibitionist intention to shock or offend, exhibitionist awareness of their actions, degree of nudity involved. So correct answer here, that is exhibitionist intention to shock or offend. That is the answer here. Exhibitionistic intention to shock or offend. So in explanation, you will get a clear picture. Exhibitionistic disorder involves the recurrent and intense urges to expose one's genitals to unsuspecting individuals, often with the intention of shocking or offending the observer, which differentiate it from consensual and legal forms of exhibitionism. In consensual and legal forms of exhibitionism, the other person will not surprised, or it is expected, or with their consent only the other person is exhibiting. But in exhibitionist disorder, the person is exhibiting his genitals to with the intention of shocking the other person or offending the other person. That is the intention. So 15th question, which of the following is a type of abnormal movement that involves sudden, brief and irregular jerks of muscles or a group of muscles? Chorea, dystonia, myoclonus, tics. Correct answer is myoclonus. So all of the options are little confusing. So we will discuss each and every one. First we will see what is myoclonus. Myoclonus is a type of abnormal movement that involves sudden, brief and irregular jerks of a muscles or a group of muscles, usually seen in seizures. It can occur in normal people during sleep or when falling asleep, or it can be a symptom of various neurological disorders such as epilepsy, Parkinson's disease or Alzheimer's disease. So in this condition, myoclonus movement may be visible. Same time, chorea means it is involved rapid, jerky, and unpredictable movements that flow from one body part to another. First, it may be start from hand, then it will goes to legs. Sometimes it may start from legs, then it will move into hands and face. So that kind of movements, wave-like form. It will start from some other part and it will spread into other parts. So that kind of movement seen in chorea. So it is known as dance-like movements. So imagine writhing fingers, grimacing faces, or sudden leg kicks. These are the examples of chorea movements. Dystonia means it is characterized by sustained or intermittent muscle contractions causing twisting, repetitive movements, and abnormal postures. It can affect any part of the body, leading to contorted limbs, neck twitch, facial grimaces, or difficulty speaking. So, dystonia means abnormal kind of posturing like movements will be seen in dystonia. Tics are sudden, repetitive, and involuntary movements or vocalization. Sometimes, like movement persons will do repeatedly. So that is vocalization. Otherwise, involuntary movement, touching the eyebrow or touching the cheek, like involuntary movement will be there. That is known as tics. Or sometimes the person will shrug the shoulder. See, these are the involuntary movements. These are known as tics. Eye blinking, sniffing, or complex jumping, shouting a phrase. Tics can be suppressed for a while, but often come back stronger. So we can suppress voluntarily for a shorter period, but it will come back later. So today's last question. What distinguishes kleptomania from ordinary theft? Presence of security cameras, monetary value of stolen items, motivation behind the theft, frequency of theft occurrences. So main difference from kleptomania from ordinary theft is motivation behind the theft. In the ordinary theft, the motivation for financial gain or some enmity between the persons. But in kleptomania, there will not be a financial gain or something, but it is doing because of the impulsivity. Kleptomania is characterized by impulsive nature of theft without personal gain or motivation. It is distinguished from ordinary theft where the act is typically driven by specific reasons such as financial gain. So that is about today's video. So thank you for watching this video. And if you have any doubt means you can comment below here. So I will solve your doubts. So if you are not subscribed to our channel, please subscribe and share with your friends. So that is about today's video. So thank you and bye bye.